Welcome to Cradle and All, a podcast hosted by sisters Renita and Christine to educate, inspire, and connect with other mothers. Every other week, listen as we discuss topics related to pregnancy, raising children, and balancing motherhood with other aspects of womanhood. Whether you're relaxing, juggling tasks, or even breast pumping, join us as we figure it out together.
Hello, everybody. Welcome back to Cradle and All.
Welcome, you guys.
We're glad that you're joining us today for our second episode, and we're talking all about birth experience because between Renita and I, we have 4 beautiful sons ranging between 7 months old to, which is my youngest, to 3.5 years old, which is the oldest of the cousin crew and he's Jackson. So,
oh my gosh, 3.5. That seems so old.
So not old. He's totally still a little person. Although sometimes, I'm shocked by how grown they are at 3.5. They seem so different than 7 months. But today we're talking all about birthing experiences through the lenses of our birth experience with each of our children. Because as I shared, it was very different with each of them.
Yeah, very different.
We're going to start with little Jackie, as I call him, Jackadoo, who is the 3.5-year-old Renita's eldest. And he started us off. This was, of course, pre-COVID. I remember that day in the hospital. We were there. For the first one, I think, of the family, everyone is so excited. We were all just so excited. We were at the hospital.
Everyone could be there at the time.
It was so nice. It was just such a happy day. But the birth experience. So Renita, think back to that day when you were about to give birth to Jackson. Talk about your birth experience, starting with whatever you want to talk about.
So, as an OBGYN, I am delivering babies every day, and I see that there can be so many different ways for this to happen. And I was just so curious as to what it was going to be like for me. Every week when I would check a patient's cervix, and they'd all be like 2 centimeters, 3 centimeters. But then when I would go to the office and get my cervix checked, it was never dilated or only 1 centimeter. And I was just like, when's it going to happen for me? And though I had this dream of waking up with my water broken or going into labor, that didn't happen. So he had to get evicted. So we got to the point that I had an induction of labor. So his experience was more of a scheduled thing, in that I came in for an induction. So what that looked like for us, my husband and I were on the induction schedule for a specific date, and I got called in. So I remember us going to dinner that night, and we were supposed to get a call around 8 o'clock, and they finally gave us that call to come in.
Wait, so you were going to get called in? What do you mean?
Yeah.
I don't know. That's how things are done.
Yes. So when you are scheduled for an induction, you are on a list to come in to have your baby. And so they have a list of who is supposed to be coming in, and that list has a list of priorities based on if there's a medical reason or what have you. But when your name gets called off the list, they call you to say, okay, it's time to come in and have your baby. And so we packed up the car with our hospital
how many weeks
bag.
Were you?
I was 40 weeks. It was my actual due date. No, I was 39 weeks and 6 days. So the night before my due date. And it was 8 o'clock. So we packed up our hospital bag and we sat in the waiting room while they called a couple other people back. And I could see some women in pain and some women weren't. But we were just sitting there anxiously. And then when we got to the room, I was not in pain. I was feeling fine. So they got my IV in. I signed paperwork. I was chit-chatting with the nurses because I also work there, of course. And my induction started. So the way my induction started, which can be different for everybody, it started off with the medicine that was used overnight. So I had this medicine called Cytotec, which is a pill that I took to help me get a little bit more dilated, and a little balloon catheter placed in the vagina. And when those things were placed, my discomfort began immediately. Not like severe labor pains, but it was starting to feel uncomfortable. And immediately within 30 minutes, the pain had gotten enough that I actually threw up everywhere.
What?
So not to be
okay.
too
So
vulgar,
how would you rate the pain? Did it feel like cramps?
It felt like a lot of pressure and cramps just because of that little balloon thing that was used. It felt like something was literally laying on my bladder. But then it turned into like, now knowing what labor feels like, it turned into like milder labor cramps. So I got.
Why did they? Sorry.
Yeah,
I'm very curious. Why did they put the balloon in there? What is that supposed to do?
Yeah. So I started off at 1 centimeter. So the balloon is just another mechanism to get you a few centimeters dilated. So it kind of acts like the baby's head and sits on the top of the cervix. And then it's used to dilate the cervix to manually to about, it got me to 4 centimeters, and it worked overnight while I also took a pill called Cytotec that through medicine helped to get me a couple centimeters more dilated and effaced. Now, effacement is the thinning of the cervix, and dilation is how wide the cervix gets. So the medicine and the balloon both work together to get me a little bit more ready for the active labor contractions to start.
Oh, wow. Okay.
And so that just happened overnight.
It's mimicking what your body may naturally do if
exactly
you're going in labor on your own.
Exactly. So this all was happening overnight, like between 8 p.m. and like 8 a.m. that morning. And so I really slept overnight while this is happening. Now, for a woman who goes into labor on her own, this process that took me 12 hours can sometimes take weeks before, you go into labor. So oftentimes when a woman shows up in labor, they have already had this cervical ripening or this softening and slight dilation happening. So they just take the induction process and squeeze all this into a shorter time frame. So that's what they were doing with me.
Wow. Okay. So you guys were there overnight. I remember because you wanted him to come on a certain day. So you basically scheduled it. You guys got in there, you got the call, but you already had known that you were going in that day.
Yes.
You had it predetermined.
Exactly. So when I knew that I was going to be induced, I picked a day on the schedule. He was born March 29th, and I didn't want to pick April 1st. So I was like, let's pick this day. So that's kind of how I knew I was going to be called in that night for his birthday to be on the next day after midnight on the 29th.
Wow. So then once you guys are in there, you're going through the process. Tell us like what happened that morning. So you said overnight it started to get more intense, but
yeah. So that morning my partner came in. She's the one who delivered me. But she came in, she took that catheter out, and my cervix was about 4 centimeters. And so I ate some breakfast, and then we started the medicine Pitocin through my IV. Pitocin is a medicine that acts like oxytocin, which your body releases to bring on labor contractions. And so I started getting that through the IV, and that brought on active labor contractions. So this is when my pain was starting to get really intense, like those real labor pains. At this point, you and mom and everybody came.
Yeah.
Oh my God. My husband, Bryson, he texted everyone and said, she's 4 centimeters. Somehow y'all took that to mean I was about to have the baby, which I was not. And you guys showed up at like 8 something in the morning.
Well, we didn't know what to expect. Again, this was the first one, and we were all very excited. So we got there first. I literally took off work. Got there first thing in the morning. And my boyfriend, who's now my husband, he even came.
Everyone was there. It was a party.
We were all there just sitting down watching her as we were watching TV. And I remember I kept thinking, like, I wonder how bad it feels. Because I remember you just kind of were like breathing. And I was like, we were just watching TV talking. And then you would like have moments of like discomfort, I guess, which were cramps or not cramps.
No, it was labor pains. Not cramps.
Walking through them.
I was just breathing and trying to be calm. But yeah, this is when a pain got intense. Also part of the induction, my partner / doctor, she broke my water at one point. And I swear, once that water broke, that's when it became like intense. That's when I was like, okay, I need an epidural. I'm ready for an epidural. This pain is too much. And honestly, when I was getting my epidural, it was so painful that I don't even remember that Bryson was there. He was like, yeah, you were squeezing my hand. And I'm like, squeezing my hand?
Yeah, Lord. I remember that because I remember his reaction was kind of funny.
So ultimately, everything, though it started off scheduled, my induction process did go unplanned because from the minute my induction started, I was having back-to-back contractions that couldn't be slowed down, and my son did not tolerate labor well. And so my Pitocin had to be turned off a few times, and his heart rate was dropping several times, and I ultimately ended up with a C-section in an emergency because his heart rate could not be brought back up.
Yeah.
And luckily he's doing fine and he's okay. But it was really scary.
Yeah. I remember they kept moving you around. They kept moving you from side and trying to get
side
his heart rate up.
Mm-hmm. Yeah, and giving me oxygen. And it was really scary. And I understood what was happening as a doctor, but when you're going through it, it's really frightening. And knowing like, oh my goodness, I hope everything's okay. I was just trying to meditate in my head and be calm. And so when we got to the C-section, it was truly an emergency C-section. When they got him out, he was blue and floppy, and they had to resuscitate him a little bit. Bryson was like whispering in my ear, is he okay? Is he okay? I hope he's okay. And he was okay. But, you know, it was really frightening, and the team did amazing, and he is just fine. It was unexpected, but it's how we ushered him into the world.
Yep. It was memorable. I remember like right when he was about to come in to the world. At this point, it was like evening. It was like 9 o'clock, wasn't it? So you had been there since the night
25
before.
Hours.
So at this point, we were still there. My family and I were still at the hospital. But then my mom and my dad were like, okay, we have to go let the dog out because it's been all day. Nala has to use the bathroom. And it
Nala's
was also
my dog.
Storming.
So the minute my parents, they had stayed there literally all day because they didn't want to miss a thing. I finally was like, please go take my dog out. Like Nala, she needs to be taken out. The minute they leave is when it was determined I need a C-section. So they are rushing back me before I leave for my C-section. My wonderful partner lets them drive into the doctor's parking lot, runs them to see me as I'm being rolled away. They get to say goodbye. It was quite dramatic. But
it was. I'll never forget. You were asleep and me and Bryson were sitting in the room. At this point, my parents left. It was me, Bryson, her husband, and Renita, of course. And so then we hear the monitor start to like alert that the heart rate was dropping. And I was like, Bryson. And then next thing you know, we noticed it, but the next thing you know, the doctors come running in. They're like, we have to do a C-section. It was like all so dramatic and like kind of, it was very urgent. We were like, we noticed it. I remember like him and I locked eyes. We were like, oh. And the next thing you know, the doctors ran in. But like she said, Jackson's doing fine now. It was a very memorable birth story. Our very first little one in our family.
Yeah,
so
our little first. Yeah. So let's talk about that for a little bit, because I also want to hear about your birth stories. But I know that can be frightening. There's people out there thinking like, oh my gosh, she had an induction, then she ended up with a C-section, and then all these things happening. And that is not everyone's story. And there are reasons to be induced and reasons to not be induced, and labor, whether you were induced or not, can lead to drops in the heart rate, but it can be so variable. One thing I'm so grateful for is being at a hospital where they are prepared for anything. I knew the nurses are going to take great care of me. My doctors and all the staff was great. But in situations where it's an emergency, it can be so frightening when everyone's rushing in and like surrounding you and telling you to flip around to get oxygen. And so I think that having trust in the nursing staff and the doctors was one big part of it, but also the fact that I felt like they were communicating really clearly to Bryson and me, but I knew what was going on, but to like the rest of the family, saying this is what's happening and having those lines of communication open when things don't go as planned. So I just wanted to clarify, if you're ever in that situation and you're scared or you're worried that can happen, just having those lines of communication open with those who are taking care of you and asking questions, even if you feel like the timing is not right, never hesitate to do that.
Yeah, I agree, because it can be intimidating, especially if you're not a physician, if you aren't comfortable with that environment to just kind of go along. But I think that's the importance of having a physician that you trust in a hospital that you trust, so that you can have your questions answered, because you never know what's going to happen. As I'll share with Dallas, like my son, who was the next one in line to be ushered into the world.
6 months later.
Yep. 6 months later. So he was there too, actually, in my stomach. No, but my experience with him was also somewhat unexpected, because he was breech at the end. I had like low fluid in my pregnancy, and
I forgot. Oh yeah.
Yeah. I had low fluid. So I had to go to actually get a couple of extra ultrasounds to measure the fluid to make sure that he was safe and that everything was going well. And the fluid, by the end, it was acceptable, but it wasn't like it was they would have liked, but it wasn't horrible. So, and I actually think I was because I was very active during the pregnancy. I don't know what the reason is, but
I don't think it's related to you being active. I think it just was what it was.
Okay. Well, yeah, it was what it was. Things happen. But with him, because of the low fluid, so maybe you can help me answer this. Like, he was breech, and I think the fluids being low didn't help that. The fact that he couldn't really turn around because the fluid have something to do with that?
That's possible. So knowing the facts about babies' positions, babies can flip and flop in all directions, but as they get further along, they tend to settle head down, which we call cephalic or vertex. Now, 10% of babies are thought to be malpositioned, meaning breech or head up, or they can be laying across side to side. And so Dallas was breech. Most babies who are breech may flip as time goes on, but sometimes they don't. And when you have low fluid like Christine had, there's less of that to float around in. So he probably didn't flip because it probably was harder for him to flip because there was less fluid. Mm-hmm. And there may be other contributing factors that we just don't know about. But
yeah. They talked about like my uterus size and shape could have been a factor. But anyway, he was breached. And so I started doing some home remedies. You know, with Dallas, I actually wanted to have a very natural birth. I started reading hypnobirthing, which is this technique, meditation and mindfulness when you're in labor to reduce pain based on the language that you use to describe labor, the thoughts that you have surrounding labor, and really to focus your energy on a positive birth. And so I read this book called Hypnobirthing in the anticipation that I would be able to use this practice when giving birth to him. And unfortunately, I could not do that because it was a scheduled C-section. So I think with this, and I'm not as memorable with numbers and dates, but it was about, I think 2 weeks before he was supposed to be born October 17th. He was born on October 12th. So it was like a little over a week.
It was 1 week, yeah.
Yep, a week before his actual due date was when they had it scheduled for. And even up until the day before, I was still trying to do things to get him to flip. Like I was some very silly things like headstands. I did not do a headstand, but like inversions.
Thank God, that's not safe when you're pregnant.
It was inversions, things I found online. It was like these put your legs over your head type of thing. Taking a bath. They said a bath did not help. I took baths. Maybe that helped with my relaxation, but I would they said maybe he would flip in the water of your bathtub. Yeah, so nothing worked. So then
before you get onto that, so there may be a lot of thoughts about, trying some of the techniques you have, and there's not a lot of good evidence that those techniques will work. However, there is a procedure that is called an external cephalic version. Was thought not to be a candidate for, but that is something that can be an option where your doctor can push basically on your abdomen and rotate the baby to be head down. Now, it's beneficial to do it if you have more fluid, if the placenta is at the back and not the front, and factors like that. So Christine's low fluid made her not the best candidate, but that is something that can sometimes help.
And we did talk about that, but like Renita said, I wasn't a good candidate. And I remember you telling me about this doctor in Atlanta who does vaginal births with breech babies.
Yes, there are still a few who do that. It's not many doctors who do that anymore.
Yeah, I was like, I want to try him because I really wanted a vaginal birth, but it totally was out of the question. So at that point, I just had to resign myself. As long as he comes into the world healthy, we'll be fine. And I kind of looked to the bright side of like, well, you know what? I get to schedule the date. We got to pick a date. We picked a Friday. We got to pick the day. I got to think about my numerology. Okay, I like the number 312 is good.
Just like I picked my induction date. I didn't want April 1st, an April Fool's baby.
So we had a Friday.
No offense to the April Fool's babies out there. Right,
no offense out there. But yeah, so Friday we got in, and then we planned it around my husband's work schedule. He had just started a new job, so he really didn't have a lot of time off yet. So that was kind of nice. So we get there. And I mean, literally, I had no pain at all. I never had any experience with any type of labor pain. I was no discomfort at all. I get there still. I was like, this is a breeze. We're sitting there, Renita. Actually, the great thing is Renita was able to be there for both delivery.
I was the photographer.
We have so many great photos of him coming out. So she got to be there just as a witness, she did not deliver Dallas, but she was in the room taking pictures.
So start back from the very beginning. I talked about when I got called in, I showed up in the waiting room. What was it like for you? Like you couldn't eat the night before, right?
Oh yeah. I forgot about that. Yeah, I couldn't eat the night before. So the night before we actually just like we're at the house preparing. We had a nice meal with my mom. She came in town from California because she lived out there at the time. And so she came in town. We had a nice meal. And then we can't eat.
You can't eat after midnight.
Okay, we did eat the night before.
Yeah, I meant like after midnight.
Yep. So then that next night, so I was very excited for that first meal. What I ate, I do not remember, but I was excited about it. So yeah, that morning it was very easy going. We went in, we drove in, everything was packed and ready to go. We got there. We went straight to like one of these rooms. I remember the room.
It's called a pre-op room.
Okay. Yeah. And that's where we got the epidural.
Mm-hmm.
And I remember when I got that epidural, like I started shaking. It made me shake pretty violently. And like I had an emotional reaction to it. I was very scared about that. But like I had this really bad shakes from the epidural.
It's pretty common that it causes women to do that.
Yep. I had that for just for the first one for Dallas. But after that, we were rolled in. Everything was going according to schedule. We were pretty much on schedule. We had a time. We even had the time set for his delivery. I think it was like 11 or something, 10:30. I don't know. But he was born at like 11 something. Anyway, so then we go back to the room. Dontrell gets on his scrubs and everything. And we're waiting to go into, gosh, my memory is horrible.
The operating room.
We're waiting.
Oh my gosh. Yes. So basically I was there, so I can recount this too. She goes into the operating room and she's getting on the table. They're getting her ready and Dontrell or anyone's partner just waits on the outside until she's ready to go. So while he is outside, they listen to the baby's heartbeat before the C-section starts. And Dallas's heartbeat was like dropped.
They couldn't find it.
They could find it, but it was a low. It had been a deceleration or a drop in the heartbeat. And so because of that, they were like, let's move quickly. And they were like, we got to just hurry up and get him out. And
it was so scary.
They ushered Dontrell in. They were like, let's move.
They rushed him in. She said ushered. No, they rushed him in.
Yeah, and it was scary.
So fast. They didn't even put that little that like cleaning solution thing on your belly.
No, they did. They did a splash. They did a really fast one.
But then they had to give me antibiotics afterward because they had moved so quickly. They did something like that because they were like, yeah, we just as a precaution because we moved so fast. But yeah, that was terrifying. So as we were waiting, I remember laying there on the table. Everyone was all jokey and nice and friendly, which was really great. They were all very positive. But then you could tell the mood in the room shifted when the deceleration happened. And they were all like, okay, we got to move. Get the husband in here. And I remember looking at Renita. I was like, is everything okay? I kept looking at her for reassurance that everything was going to be okay. And it felt like forever between when they started and when he got pulled out.
But it was very fast.
It didn't seem fast to me. It seemed like it took forever. And I was so nauseous. I think another side effect of the epidural was when they were pulling him out, I felt a lot of pressure on my chest. I felt like I had to throw up, so much so that I asked them to bring me some type of nausea bag. Because you're in the C-section, they had the anesthesiologist, I guess, like monitoring you.
Mm-hmm.
And so I kept telling her, like, I'm going to throw up. I'm going to throw up. I feel pressure. I feel it. But what I felt, I believe, was just pressure. I didn't feel cutting and opening, but I felt a lot happening on my body that felt really weird.
Yeah. But
they pulled him out and he pooped.
I have the pictures to prove it.
He pooped right away. He came out butt first with poop in his butt. And then he was fine.
Yeah. So it was also a little bit of an unplanned moment.
Oh yeah.
In the sense that his heart rate dropped a little bit, but he was fine when he came out. But you know, these babies, they do what they want to do and things happen. Not everything goes according to a textbook. It really is not always like according to plan, but ultimately they did really great. And the beautiful thing is that every person who works on labor and delivery, from the doctors to the nurses to the techs, to like everybody is ready to handle these kind of things. So that's great.
Yeah, I felt that way too. I didn't feel worried that I think worry is always a part of it with the anxiety of the unknown, but I was confident that he would be okay. especially because you were there. I think everyone should have an advocate there for them. If it's not your husband or your partner or a spouse, maybe a midwife. I think it was so helpful to have you there because I felt even more confident and comfortable because I knew that you understood what was going on. So I felt like
100% agree about that. And I could not agree more. Whether it has to do with labor and delivery or any health thing, having somebody else who can ask the kind of questions that you're not thinking about in the time or be able to speak up for you when you're too nervous, I think is so important. And I mean, it's sad because right now with COVID, it's a little tough with having other people there, but thank goodness for technology where we have Zoom, Zoom, I guess, and Skype and everything like that. So
yeah, that made me so comfortable, made a huge difference. So
yeah,
Dallas came out and then everything from there was great. It was great.
Well, tell me a little bit about your experience with Dakota. From Dallas being unexpectedly breech, needing a scheduled C-section, it seemed like you got everything you wanted with your delivery with Dakota.
I really did, because while the pregnancy may not have been perfect, Dallas I had a great pregnancy. The delivery was not what I wanted necessarily with the C-section, but with Dakota, I was so grateful that I could actually have a VBAC. I really, really, really wanted one so badly.
So explain what a VBAC is. Vaginal birth
after cesarean. Yep. Mm-hmm. After C-section. And that is something that really depends on the practice or the hospital. It may not be as common, or it may be common in the state that you live in. I know my cousin lives in New York, and she said all the doctors out there advocate for VBACs, but I think it really just depends on your previous birth experience. Renita, you know way more about this, but yeah, I had a VBAC, and then I could tell you what my VBAC was like. But what do we need to know about VBACs?
So that VBAC stands for vaginal birth after cesarean section. And so when somebody has had a cesarean section before, you basically have this incision on not just the skin, but also the uterus. So when you think about trying to have another baby, we always want to keep in mind that incision on the uterus can sometimes tear apart, and it can be an emergency that's risky to you and baby. And so it's called a uterine rupture. And everybody who delivers babies, they want their patients to know that if you have a vaginal birth after C-section, that risk is there. It's a generally low risk, 1% if you had one C-section, but usually if you've had two or more, that risk can get even higher. So there's some guidelines that we as OBGYNs have saying if you've had two or more, you always have to have a C-section. You cannot try for a vaginal birth because that risk is a lot higher. Or if you have a C-section that's not your typical, like where your incision's up and down, or something that has caused any scarring on the uterus, like if you had fibroids removed from the uterus in the past, then you're not a candidate for a vaginal birth after C-section or a vaginal birth at all. So I think that vaginal births after C-section or VBACs are really great for women who want to try them, and it can decrease the risk of having a lot of C-sections, but it's just important to know the risks. So Christine was able to have a wonderful, successful VBAC, which is great.
And and the reason I wanted one is because I wanted to experience labor, which people don't understand. Like my mom was always like, why do you want to go through the pain? I'm like, I just want to experience what we were born to do, like what my body is capable of when it comes to labor. Yeah. So that was one reason. I was kind of scared after the C-section. That was my first and only major surgery outside of like a wisdom teeth removal. So I really did not like the surgery aspect of it. I don't like the healing, the medicine. And then also I just wanted to, I wanted that experience. That was my primary goal, was to have that experience. And so one thing, I was working with my doctor and I told everyone I met with from the beginning is like, I want a VBAC. And they all were very receptive. They knew what my desires were. And as we got closer, we had to still schedule a C-section date just in case I did not go into labor on my own, which I was so scared about. But that was something I was like, really like, had to schedule it. And Renita, you tell me the exact date.
So this is also another very important thing I want to talk about. So as Christine has mentioned before, she comes to my practice. Every practice may have different policies about vaginal birth after C-section. And part of it is knowing what is important to you and knowing what the policy of your practice is. In my practice, our policy is that you have to deliver by your due date. And if you don't deliver by then you'd have a C-section. And some of that goes into based on our access to the hospital, our review of the literature and risk of C-section and things like that. There may be some practices who do not allow for VBACs at all. And there may be some practices that allow for VBACs and allow you to go further than 40 weeks. So when you're making a decision about what you want for your birth plan and your type of delivery, it is important to ask these questions in advance. And if it's a practice that doesn't meet your goals, check out some other practices and see if there is a practice that may meet your goals. And so Christine was scheduled for a C-section on her due date. And if she had gotten to her due date and didn't deliver at that time, then she probably would have had a C-section then.
Yes. And it was very close. About a week before my scheduled C-section, I did end up going into labor, thank God. And I actually, again, just like with Dallas, I was preparing in advance. I was determined to have a vaginal delivery with Dakota. So what I was doing was, one, I was meditating, actually, some hypnobirthing again, but really practicing breathing techniques at night. I would put on like some YouTube channels and practice breathing and the positive affirmations, which was very calming and helped me like try to feel like I would be in control when I was in labor. Of course, I'd never experienced labor. I knew it would hurt. So try to practice that hypnobirthing, those techniques. And then as it got closer, like about 38 weeks is when I started, maybe 37 is when I started the hypnobirthing meditation. But then about 38 weeks, I started doing some things to like spur labor because I felt like maybe I need to do something to make sure that happens so that I'm not going to have this C-section. So I would go walking every day, bouncing on the ball. I found some exercise I would do every day. I started drinking red leaf tea. So I started doing a lot of things. You know, I am advocates of taking your own health into your own hands if you would like to. I don't know, as a physician, Renita might have some other ideas, but I literally tried everything. And I do feel like those things helped. But I also am an advocate of taking control of your health, getting the information, and, you know, being a part of your health team. Don't just let somebody tell you what to do. And I always tell patients who ask, what can I do to go into labor? If it's safe, sure, try it. Like red leaf tea, is the data there? No, not really. But is it going to hurt you? No. So go ahead and try it. I definitely tried a lot of things myself. Did they work for me? No. But if it's not safe for you, like drinking castor oil, do not do that, please. Okay, so, I did that.
Yeah, you shouldn't have done that.
I did that. I did the mother's, what is it called? The midwives brew. I did that.
What's that? I've never heard of that. I'm sure a midwife did not come up with that.
So the midwives brew is a mixture of castor oil, some type of green tea. It's a whole recipe you can find online. And then you drink it within 20 minutes and then you see what happens. And actually, after I drank that, I did experience what I feel like was the beginning of labor. It took a couple of days and I only drank it once. Mm-hmm. And of course I was looking on YouTube. I did my research on YouTube.
I'm going to pretend I didn't hear that.
No, but so that's why I said I think it helped. Like I had cramps. Maybe it could have been like gas.
Most likely.
But it did do something.
GI upset from drinking castor oil.
It could have been.
I think
that
so.
Stuff is really gross. Oh my God, it's nasty. But okay, so I did that on the Monday. Tuesday, the cramps were so bad. I call them cramps. I think it was labor pains. It was labor pains overnight. Just kept me up all night, so bad. But the next day,
yeah, you were calling me, I think.
Yes.
Yeah, you were
I was like, oh my God, I'm in labor. But then the next day comes when the sunrise hit, the pain all went away. So like during the day, nothing. But the night before, it was intense labor pains. And I was so weird. It's like, how come I experienced that the night? Probably the castor oil. But then the next day, everything was back to normal. But then that Wednesday, I had an appointment and they scraped my membranes. They stripped my membranes that Wednesday. That Wednesday night, I was having labor pains. And I know it was labor pains. It was like very, very, very intense. I could not sleep. I was just laying in bed doing those breathing techniques. The next morning, I get up. I call my sister like first thing in the morning. I was like, no, I didn't call her yet. I woke up. My husband was like up with me all night. I woke up, I get up, get my son ready for first daycare. I go in the bathroom, kind of get myself ready, sit on the bed. As soon as I sit on the bed, I feel a gush of water. And I was like, oh my God, water breaking? And I like feel down there. I was like, okay, that's a lot of liquid. And I was like, called my husband, Dontrell. And I go into the bathroom. He was in the room with my son. So I'm like, okay, I think my water broke. Then we FaceTime Renita. And I was like, okay, I think my water broke. And then she gave me directions like, okay, call the doctor, tell them water broke. Head to, and then, wait, what did you tell me?
I told you put on a pad to see if it keeps coming, because if your water breaks and it's going to just keep on coming and your pad's going to get soaked. But if it's not, if it's just like pee or discharge, then it's not going to keep coming. So I told you to do that first.
Yep, and you did. And then you said, see if it keeps coming and then call me back.
Yeah.
And then you also said the pain may intensify.
Mm-hmm.
So if I feel those things, then I'll know I'm in labor.
Yeah.
And that happened. So then I called her back. I told her like, okay, it's been an hour. It's still coming. I'm in more pain. The pain really hadn't gotten too bad yet, but I was like, something's happening. And at that point, we made a plan to head to the hospital. So we head to the hospital. And as I'm in the car heading to the hospital, it really starts to intensify and the pad starts to get bloodied, actually. So I think that's the bloody show, right?
Mm-hmm. Yeah.
So it's starting to get bloody, and then the pain really, really picks up. Like I could not talk when I was experiencing those cramps, or I call them cramps. When I was experiencing the labor, like I could not talk. I just like can't say anything. So we get to the hospital, we get admitted, we go through the whole process of everything. What was interesting to me though was that they would not admit me until they confirmed I was in labor. So they had to test the fluid to confirm that it was like amniotic fluid.
Yeah. Mm-hmm.
Yep. So they tested that, which I was like, okay, what else would it be? This is
pee.
Obviously what's happening.
It could have been pee.
It's not pee. Bloody pee? No.
Well, you knew that at this point. They just saw you.
It had been it would have been like an hour at that point. They tested it. Obviously, that's what it was. Anyway, at this point, they were checking my cervix. I think I was like, oh gosh.
4.
Like, at this point, when I first got there, I was 4. So overnight, I had dilated from 1 centimeter to now 4 when I first arrived there. So then they finally pulled me into the room. I think the hospital was kind of full, so that it was a little delayed getting me through. So I get to the room and the labor honestly is progressing. And as she keeps checking, everything's moving along fine, which I was so grateful about. As you know, I wanted that VBAC. I kept being dilated as time went on. I was progressing very quickly I got to the hospital around 10 a.m. and by 7 p.m. he was born. I was only pushing for about 7 minutes, and I got the
if
epidural.
that.
It was very quick. I got the epidural around like 3 o'clock. So at that point, things really started to feel good. Everything was moving along, and it was just so easy going. I was so blessed to have such an easy delivery with Dakota, from the water breaking to just everything was moving along just so smoothly. It could not have gone any better. And what makes it even better is that Renita was able to deliver me even during COVID. So because she works at the hospital, she was able to get in there and to help me, because my family, of course, couldn't be there except my husband, but she was able to bring him into the world. And, you know, by 7 o'clock, we were holding him in our arms, and then I was standing up, walking around 10 minutes later. It was really great. It was a totally different experience from Dallas. Both really great experiences, memorable, but I'm so grateful that I had those 2 different experiences, because I got to accomplish what I wanted in childbirth, which was to experience that vaginal delivery.
That is so awesome. So beautiful. And it's always just amazing to watch those experiences when they come into the world, and it's just makes your heart melt.
Yeah.
So that's great. Yay.
So we have one
VBAC.
more to talk about. Yep. Successful
Yes.
VBAC. I hope everyone, if you want a VBAC, I say go for it. Do your research, learn about it, advocate for yourself, because it's definitely possible and it could turn out really beautifully. And even if it doesn't, at least you can say you tried.
Exactly. Now, my second birth was not planned in any way, shape, or form. And I, too, was hopeful for a VBAC and wanting that experience, especially because delivering babies every day, I see the joy that women have, both vaginal and C-section, but you want that feeling. So though I had the experience of labor with Jackson, I ultimately didn't get to push and birth him in that way. And so I was hoping for that with Russell, but that is not my experience at all. And life happens. And at the end of the day, he's here and he's amazing. But his experience was completely different because I ended up with a unscheduled C-section due to complications in the pregnancy. So he was born 9 weeks early. From the minute that I got pregnant with him, there had been many complications, starting off with first trimester bleeding. In the second trimester, when I was being checked by my ultrasounds, he was growing too small. So we were doing extra ultrasounds to figure out why his growth wasn't what it was supposed to be. And then I ultimately developed blood pressure issues, developing preeclampsia. And because of my preeclampsia and his growth issues, I had to be on bed rest in the hospital for a week before he delivered. When I was in the hospital for that week, I was on the monitor where they looked at his heart rate, and his heart rate was in distress from the minute we were there. So it turned into being on the monitor, checking his heart rate a couple times a day, to ultimately needing to be on the monitor for 24 hours a day. Ultimately, his heart rate was looking so bad that I had to be on oxygen, and he began having drops in his heart rate. And at 31 weeks and 1 day, in the middle of the night, we have to deliver him.
You had a heart rate monitor at the house, right?
Not at the house, just at work, I guess.
Well, the reason you went in, though, is because you were monitoring his movements, right?
Right. So I initially got admitted to the hospital because I developed blood pressure issues. And when they put him on the monitor, he saw that his heart rate didn't look good. But things overall weren't too bad. And my blood pressure was, though elevated, stable. So they sent me home and said, keep an eye on how he's moving. If you see any changes in his movement, then come back. So I got admitted to the hospital, went home in 24 hours. When I got home, his movements stopped. I went 7 hours and he was not moving, and that was not typical for him. And I kept second guessing it and saying, am I just thinking this? Am I not paying attention? But ultimately it had been 7 hours with minimal movement. So I went back to the hospital, and from that point stayed about the rest of the week and ended up delivering him. So there was clearly complications happening. But because of that, he ultimately was delivered early, and because it was 31 weeks and 1 day, and he was having distress, the decision was made and I had a history of a C-section. The decision was made to do another C-section. So,
and mind you, decision that was not made lightly, because we were discussing, weren't we? I feel like there was some talks about, do we wait? What do we do? We were trying to advise you or hear you out, hear your thoughts about what is the right decision that we make for his health and for your health too? That was another big question for us. And my mom was always like, your health matters. Like, everyone's thinking about the baby. What about your health? Because preeclampsia is a, quite a serious condition. Can you tell everyone, what is preeclampsia?
Yeah. So preeclampsia is a condition that can develop in pregnancy where you get high blood pressure, even though you don't have a diagnosis of elevated blood pressure when you're not pregnant. It can come up in pregnancy. It can lead to liver problems and kidney problems and swelling around the brain when it becomes severe. But it also can lead to problems with baby, which is ultimately what was happening to Russell. His placenta was not providing enough nutrition to him, so he wasn't growing. And it can lead to mom or me having seizures and serious complications. Mind you, a month before I was diagnosed with this, another Black OBGYN was diagnosed with this and died in her own pregnancy. So it can be very serious.
And I think it's important to take notice of your body, because you were complaining or taking notice about different things in your body. I remember the week before you went to the hospital, we went to Asheville, North Carolina for a baby moon. And you were complaining about swelling that you were having.
This pregnancy was just so different. I was getting so short of breath all the time, even when I would just be sitting still. My heart was skipping beats. I was getting swelling out of nowhere, which I was like, what is this? This is strange. And then within a week, I was diagnosed with preeclampsia. And so that is correct. Listening to your body and realizing, something is up here is the most important thing. But I, trust my doctors and I trust my team and the nurses and everybody. And I was like, let me just sit back and let them do their jobs, because I know how hard of a decision it was to deliver him early and figuring out when that right time was. But that's what needed to be done. And I'm so grateful that he's here and doing well. And so because it got to the point that he was just continuing to not do well, my blood pressure was still not doing good. They said, let's go ahead. We've done everything we can to get him ready for delivery. Let's deliver. And so at 31 weeks and 1 day, on the most random day, I did not expect he was going to be born this day. It was 2 days before Thanksgiving. Here I am getting ready to go to a C-section. Mind you, I got admitted to the hospital the day I was supposed to take my maternity photos. I had not bought one thing for this child, not one. Thank goodness for hand-me-downs from my oldest. We had no clothes, diapers, all the things you do to prepare for a child, did not have. I didn't pack a hospital bag. My husband just ran to the house and put a bunch of things together. So it was a very different experience, not just in that he was born early, but also in that we were not ready for him to be there. And so some of the things that you get excited about, that anticipation of when is he going to be here, when you're waiting and getting the room together, we didn't do any of those things. And it was still really
wasn't
beautiful.
Even together yet.
Oh my goodness. We didn't even know what the plan was going to be for his nursery. So it was very different. And so I remember telling Bryson, take pictures of everything. I don't want him to look back and be like, let me see the pictures of the day I was born and we didn't have anything. So we just began taking pictures and just getting excited, because we're like, this is going to be the day of his birth and we want to remember that this is it. And so we got back in that C-section, and I had been there before because we had a C-section before, but I remember thinking, this is it. I know that this is now C-section number 2. And I'm not going to be able to have that vaginal birth if I ever have another baby. And so there was a sadness to that too, because I, for one, was having a preterm baby, but also like I am going to lose that opportunity to be able to have a vaginal birth. So I acknowledge that disappointment was there, but it doesn't take away from like the happiness and the joy of having my son born too. And it was a beautiful day. His delivery was beautiful, and we just took tons of pictures, and it was really great. But it's just not what we expected. And looking back, my deliveries were not what I expected with either of these kids. Not at all. But it was still amazing.
Yeah. I feel like it's hard to even know what to expect with these deliveries, because you don't know what it will be like until you're there. Even with Dakota, when that delivery went so well, I could not have even had expected that. I didn't even expect that to happen. I hoped for it and I prayed for the best, but I didn't expect. It's just like, let's see what we get. I feel like it's their world. We just live in it. We're just living here to be their vessel, to be their sustenance, to be their entertainment. We're just here for them. So I think, Russell, he's a little kinship, because I was also preterm. I came 2 months early. I was unexpected. It was an unexpected.
On a holiday
too. Yeah. So, and I think that's so special. So that's a conversation I think we would love to get into on another day, is just that experience of the birth with Russell and that entire experience with him in the hospital, and what that was like for you. But with your delivery, no matter what that is, your birthing experience, I think just being prepared for the unexpected. Expect the unexpected. In every single story, I think that's a common thread, is just, you don't know what will happen when you're in that laboring and birthing moment.
All right, we are back with Rapid Fire. This is the part of the podcast where we quickly answer questions relating to the topic that we're discussing today of our birth experience. So, ready for rapid fire, Renita?
Oh, yes.
All right. So first one, baby must-haves at the hospital.
Anything that would make a memory. So a cute outfit or something that is from the time of birth.
Yes, I agree. Baby outfit. I really like, actually, no, for me, It's a swaddle. I really don't like those hospital swaddles that they give. They're so rough. So I always bring my own swaddles.
Yeah.
Daddy must-haves at the hospital.
A phone charger and extra pillow. I guess that's 2 things.
Well, let's say partner. Maybe it's not a daddy, but it's a partner, somebody that's not delivering the baby. I would say a pillow or something comfortable to sleep with, because those little couch chairs,
miserable,
bed chairs, whatever they call them, so uncomfortable.
Yeah.
Unexpected joy. Did you have anything that you're like, oh my gosh, that was so sweet and nice?
I think unexpected joy that I didn't think of was the time in the hospital where it's just the 3 of us. Like, you think about what delivery will be like and everything like that, but once the baby's there and the hours afterwards, those little moments, I didn't know what to expect. So that was an unexpected joy.
Yeah, that's sweet. For me, it was certain nurses that were so sweet and thoughtful. There was one in particular that I will never forget for as long as I live. She was just so sweet, so kind, so thoughtful. And I didn't expect that. I just thought, kind of based on my experience, I really love when the nurses are just so sweet and kind, because you interact with a lot of staff. Mm-hmm. Mommy must-haves at the hospital.
Slippers, because it's like you're away from home. You want to feel comfortable walking around that room. So I think slippers.
That's a good one. I would say a robe. I learned after my second one, I'm like, okay, this bed can be kind of a robe, felt like I was wearing a blanket.
Yeah. Mm-hmm.
Most important or necessary thing?
I think this for me is probably the nursing pillow, like either your boppy or my breast friend, because learning how to nurse in the beginning, you want to set yourself up for success in how you do it at home. So I feel like that is really important.
Me, it was the scent diffuser. I love that thing so much. Like, the room smelled so good. Every time someone walked in, they were just smacked in the face with the smell of lavender, or peppermint. So that was a really clutch product to have.
Yeah. Mm-hmm.
Most useless thing to pack for the hospital?
Anything that they have there, like pads and honestly even some underwear and stuff like that. Anything that you can get from them. So take everything you can.
Oh, yeah, that is a good one. Most useless thing? I agree. Yeah, what they have there. They have lots. So I second that. Things to take home with you from the hospital.
Literally everything. So take the pads, take the pacifiers if you want them, take all the things provide for you.
I would say, I know you love this, that water jug they give you.
Oh, yes.
Oh, my God. You know what? Wait. Also, I would say that, all the little things, the baby, like I still have his little wristband that he had on.
Yes.
I have one on the side from the door. Things like that are like, oh, this is from when you were in the hospital, that can show them when they're older.
Little cute. Oh my gosh. One thing I took from Russ, he was in the NICU, his little blood pressure cuff, which could literally fit around my pinky. And I'm like, I'm going to show him one day. This is what they use for your blood pressure cuff.
Wow.
They gave it to me, by the way. I didn't steal it.
Music or no music during delivery?
This is actually interesting. I would say music. I didn't push, as we talked about today, but a lot of people don't have music in labor, and I think I would want that.
I did not have music. I had it. I think I was too focused to even think about music. I think maybe that's where your partner comes in handy. So I don't think it's necessary. You know what? I did put it on when I finally got the epidural. I was like, oh yeah, music. So I put on my earbuds and I listened to my hypnobirthing. So
that's good.
It could be helpful if you are aware enough to put it on.
It can set the tone. Just like the diffuser, it sets the feel of the room.
Right. It does. And finally, family or no family in labor? Do you want them there with you? Want me there? Yes or no?
No. No offense. It was a beautiful experience to have you guys there, but I also think it's also a beautiful experience to just have you and your immediate family. So it can be yes and no, but if I had to pick one, I'd say no.
I would say yes, only because I didn't get that with Dakota. And also with Dallas, y'all weren't there either, really.
That's true. Okay, I changed my mind. I would say there for the pushing, not for like the whole day of this experience, but like when it comes to pushing, I would want you guys there. I want you guys each to hold a leg. Mom and sister, that is.
The laboring, okay, yeah, it was nice to have you there. As far as everybody else, I don't see a point in them being there. They might get on my nerves if they're like talking too much and stuff. So I would prefer kind of the opposite of you. I'd rather have them there for the day and then leave when it's time to push than come back in. Okay.
All
right. That's our rapid fire of our birth experience.
Now, one thing I always know is that birth never goes as planned, but you hear all the time about birth plans. So, one, Christine, I want to know did you have a birth plan?
What is a birth plan? Can you just start by telling us that?
So first of all, you don't have to have a birth plan, but I think that the most important thing out of a birth plan is just to communicate to your provider what you're looking for in that experience, because it's going to be one of the best days of your life. So what's important to you? It doesn't have to be details about like IVs and medicines, but sometimes just like what you want the ambiance to look like, what you want that feeling to look like, and how you want to be communicated with when it comes to something that's not according to plan. If an emergency C-section comes up, if you need a vacuum delivery, understanding the indications for those things and how that will be decided. I personally did not have a birth plan. My only plan was to have a healthy baby and to have an epidural. But
yeah, I really don't think I did either. Yeah, no, I didn't, because of course with Dallas, it was a very sterile environment. There was not much there. And with Dakota, I was just focused on myself more so, like me and the baby. I didn't have any wishes that I communicated. So I did not have a plan. However, I did have certain things in the room and certain things for myself that I had once they arrived.
Yeah. Well, we hoped you enjoyed hearing a little bit about our birth stories and seeing that the labor and delivery experience can be different but beautiful for everyone, even if it's not what you expect. Join us in 2 weeks where we'll be talking all about infant and newborn sleep. Don't forget to subscribe to our podcast so you don't miss a thing, and leave us a review. You can also follow us on Instagram at the Cradle and All, or email us at thecradleandall@gmail.com.